Doctors. So topic for today will be pharyngeal arches and derivatives. Pharyngeal arches are the component of pharyngeal apparatus. So pharyngeal apparatus consists of pharyngeal arches, pharyngeal pouches, pharyngeal clefts and pharyngeal membrane. Today we'll talk about pharyngeal arches. It is one of the most commonly asked questions in the MBBS first prof anatomy paper. So, what are pharyngeal arches? Pharyngeal arches are thickened mesodermal bars. Thickened mesodermal bars present in the floor and the lateral wall of the primitive pharynx. In primitive pharynx. Okay. To be more specific, floor and lateral wall. Okay. So these are the thickened mesodermal bars present in the floor and the lateral wall of primitive pharynx. So pharyngeal pouches are mesodermal bars between the ectoderm and endoderm. So the endoderm, towards the endodermal side, we have pharyngeal pouches, and on the outer side, that is the ectodermal side, we have pharyngeal clefts. Okay, so earlier there are 6 pharyngeal arches. Fifth one disappears, so only 5 are left, and between them 4 pouches and 4 clefts on either side are present. Okay, so 5 arches remain and 4 clefts, 4 pouches. Okay, fifth one disappears. Okay, fifth one disappears, so only 5 arches are left. So we have seen that these are the 1, 2, 3, 4, 5 pharyngeal arches, and on the endodermal side this is the pouch, and on the ectodermal side this is the cleft. So pharyngeal arch consists of a core of mesenchyme or mesodermal tissue. It is covered externally by ectoderm. We have already seen this is ectoderm, and internally by the endoderm. Okay, it is a mesoderm present between the ectoderm and endoderm. Okay, so what it consists of? It consists of an artery. A cartilaginous rod, a cartilage, a muscular component, and a nerve. Okay, so every arch has its own artery, nerve, cartilage, muscular component, and bones that develop from cartilages. Okay, so we have an artery. This is an artery, this is cartilage, this is nerve, and we can see this mesenchymal condensation forming muscles. Okay, so the most important question generally asked in the exam is the derivatives. Okay, derivatives. So first we'll take the first pouch, first arch. Okay, first pharyngeal arch. Okay, so derivatives. So first we talk about the muscles. Mastication muscles of mastication. What will be included in it? Pterygoids, lateral and medial pterygoid muscles. Medial and lateral pterygoid muscles are included in it. Temporalis and masseter. Okay, so these are included in it. Okay, then we have anterior belly of digastric. Okay, anterior belly of digastric. Then we'll have mylohyoid muscle. Then we have tensors. There are two tensors, tympani and veli palatini. Okay, so these are the muscles. Then we'll come on the nerves. So nerve is mandibular nerve. Okay, and we have also cauda tympani nerve. We'll see the concept of post-traumatic and pre-traumatic at the last. Okay, so cauda tympani nerve is also there. We'll see the post-traumatic and pre-traumatic concept at last of the lecture. Okay, then skeletal elements. Okay, then premaxilla, maxilla, zygomatic bone, temporal bone, and malleus and incus. Okay, malleus and incus, malleus and incus. Okay, then the ligaments. Ligaments are malleus, anterior ligament of malleus, and second one is sphenomandibular ligament. Sphenomandibular ligament. Okay, there will be a term known as Michel's cartilage. Michel's cartilage. Okay, if this term comes, it is related to first arch, Michel's cartilage. Okay, then the second arch. Second arch, we have muscles of facial expression, muscles of facial expression. We have anterior belly of digastric in the first arch. So here we will have posterior belly of digastric. Posterior belly of digastric. Then we have stylohyoid and stapedius. So these are the muscles. Then nerve is facial nerve, that is seventh nerve, and we have stapes, styloid process, okay, SS, second arch, S. So styloid process, stapedius, stylohyoid muscle and stylohyoid ligament. Okay, when we'll come on the ligaments also, styloid ligament. So styloid process, stapes, and a part of hyoid bone. Which part? So if suppose this is the hyoid bone, if this is the lesser cornu, this is the greater cornu, and this is the body, then this part, then no, sorry. If we see, if this is the lesser cornu, this is the greater cornu, this is the greater, and this is the body. Okay, so body, upper part of the body and the lesser cornu are derived in the second arch. Okay, so lesser cornu and upper part of the body. Nerve is facial nerve. Okay, facial nerve. Nerve is facial nerve. Then comes the third arch. And if the terms comes the Ricard cartilage, Ricard's cartilage, then it is related to second arch. Okay, Ricard's cartilage. Then the third is muscle will be only one, stylopharyngeus, and we all know which nerve supplies it, glossopharyngeal nerve. So glossopharyngeal nerve is a nerve of third arch. Muscle of third arch is stylopharyngeus. And we have already seen which part will be derived. Greater cornu of hyoid bone and lower part of body. Lower part of body of hyoid bone. Okay. So it's easy. Now fourth one and sixth one. So muscles of the fourth arch are cricothyroid, constrictors of pharynx, muscles of palate, except tensor velli palatini, because it is already being supplied by the nerve of the first arch. It is derived from the first arch and it is also supplied by the mandibular nerve. Okay, and the nerve is superior laryngeal nerve. Sixth arch nerve is recurrent laryngeal nerve. And muscles will be intrinsic muscles of larynx. Intrinsic muscles of larynx except cricothyroid, because we have already seen it is the muscle of fourth arch, cricothyroid. And skeletal elements of fourth and sixth are laryngeal cartilages, except epiglottis. So we know that the laryngeal cartilages are thyroid, cricoid, arytenoid, corniculate and cuneiform. Okay, these are the laryngeal cartilage. Epiglottis is not included in it. Epiglottis is also a laryngeal cartilage, but it is not derived from fourth or sixth arches. Okay, so we should see some diagrams. So this is the first arch. We have already seen what are its derivatives: malleus, incus, anterior ligament of malleus, sphenomandibular ligament, mandible. Okay, body of the mandible. Second arch, Ricard's cartilage. First arch was Michel's cartilage. Okay, Michel's cartilage. Second arch, Ricard's cartilage. Stapes SS. This is a stapes styloid process, styloid ligament plus muscle is also styloid muscle was also there. Lesser cornu of hyoid bone and upper part of the body. So this is the upper part and lesser cornu. Okay. Third arch, greater cornu of hyoid bone and lower part of the head. Fourth arch, Except epiglottis, all the laryngeal cartilages. All the laryngeal cartilages except epiglottis are derived from fourth and sixth arch. So we again see malleus, incus, anterior ligament of malleus, sphenomandibular ligament, body of mandible. Stapes, styloid process, styloid ligament, styloid muscle is also there. Lesser cornu, upper part of body of hyoid bone. Okay. Third arch, greater cornu of hyoid bone, lower part of the hyoid bone. Fourth arch, cartilages of larynx except epiglottis. So, should we revise again? First arch, this table is from Yogesh Sontakes's embryology book. So, first arch, Michel's cartilage, muscles of mastication, tensors, tensor villi palatini, tensor tympani, anterior belly of digastric, mylohyoid muscle. So there is chorda tympani, pre-tympanic and post-tympanic mandibular nerve. We'll just see this concept. Premaxilla, maxilla, zygomatic bone, temporal bone, malleus and incus. Anterior ligament of malleus, sphenomandibular ligament. This is first arch. Okay. Second arch, muscles of facial expression. Anterior belly first arch, posterior belly second arch. Styloid. This must be styloid. Okay, this must be no, it's good. It will be styloid muscle. We have styloid ligament also. We have styloid muscle also. We have styloid ligament also. Stapedius, facial nerve, stapes, styloid process, shorter or lesser cornu of hyoid bone, superior part of body of hyoid bone. Okay, second arch. Third arch, stylopharyngeus muscle supplied by glossopharyngeal nerve, greater cornu of hyoid bone, lower part of body of hyoid bone. Fourth arch, picothyroid, consists of pharynx, muscles of palate except tensor villi palatini. Sixth arch, intrinsic muscles of larynx, except picothyroid, and the nerve is recurrent laryngeal nerve. And fourth and sixth arches give rise to laryngeal cartilages except epiglottis. So there is a concept of pre-tympanic and post-tympanic. So the nerve which is cranially present, this nerve is cranially present, it is post-tympanic. Okay, post. And the nerve which is caudally present, it is pre-tympanic. So we have fifth nerve in the first arch, post-tympanic, and pre-tympanic is the chorda tympani nerve. This is chorda tympani nerve coming from the seventh nerve, but it is a nerve of chorda tympani nerve is a nerve of first arch. In humans, except the pre-tympanic nerve of first arch, all the pre-tympanic nerves degenerate. Okay, so we'll take only pre-tympanic nerve in the first arch, that is chorda tympani nerve. It is caudally present. Cranially we have post-tympanic. If in humans, that is fifth nerve, and this is the seventh nerve. Seventh nerve is giving rise to the chorda tympani nerve. Okay, facial nerve is giving rise to the chorda tympani nerve. This is the glossopharyngeal nerve. In humans, most of the authors say that chorda tympani nerve persists while all other pre-tympanic nerves in humans degenerate. Friends, this is all for today. Pharyngeal pouches, clefts and pharyngeal membranes will take some other day. Okay.